This morning we've been putting up questions for our The Science of Sex quiz, and now we're getting the answers, some of which may surprise you. Dr. Eileen Palace, our relationship expert, is here with what you need to know, and thank you so much for being here.
Good morning, thank you.
Okay, so basically we've been putting up these questions all morning long. We're getting the answers, so I'm just going to play the teacher, ask the question,
Okay.
And they're all true or false, right?
They're all true or false today.
Okay, so the first one, is it common for young men to have erectile dysfunction as older men?
Yes, in fact,
Really?
26% of men under 40 have erectile dysfunction, which is comparable to the same stats that you would find for older men. Now, of course, there's a difference in the reason. The older men were often seeing diabetes and cardiovascular problems, medication, prostate cancer, whereas the younger men, there tend to be more cognitive issues like performance anxiety, performance pressure, relationship issues, anxiety, depression, and more recently, pornography-induced erectile dysfunction. So if you're a young man and you're having these difficulties, you're not alone. It's getting quite common.
Okay.
And they're treatable.
All right. Moving on to number two. Most women can benefit from some form of hormone replacement therapy, including for heart health.
Absolutely.
Really?
In fact, with estrogen, there's a 40% decrease in cardiovascular events. We know that estrogen is extremely cardioprotective, and it also enhances a variety of other problems. It improves decreased risk of stroke, diabetes, breast cancer, colon cancer, Alzheimer's, and even mortality. So finding a good hormone replacement therapist, either an OBGYN or a reproductive endocrinologist, is very important for women's everything, including their longevity.
You're right, that one did surprise me. Okay, number three, sex has no age limit.
Right. Okay. People always say to me, clients particularly, they'll say, well, I know this is probably only because I'm getting older. No, there is no age limit on sexuality. There's no reason you should be having sexual dysfunctions with arousal, desire, orgasms, erection included as you get older. All these things are quite treatable, and you can have a happy, healthy sexual life up into your 90s, up to 100 if you can do it.
All right. The next one, sex is natural.
People say this all the time too. I pulled that one also from patients. They'll say, well, isn't it natural? It just happens. No, not at all. Oh. Like any interpersonal behavior and skill, good sexuality comes with patience, practice, knowledge, interest, and a willingness to learn. More experience, more time, communication with your partner, communication and good listening will help to increase communication skills, sensitivity, sexual technique, etc. So be open, learn about your own sexuality, not just your partner's. Take control, especially women, take control of your sexuality, have good knowledge of your own body, and you'll be able to share it with a friend.
All right, the last one, if I go for sex therapy, that means my sexual problem is psychological, all in my head.
Yeah, no.
False. This one's false.
No, I hear that all the time too. People go, oh, my urologist or my OBGYN or my primary care sent me to see you. It must mean that I'm crazy and it's all in my head. Not at all. Sexuality is a combination of physiological problems and psychological problems. It's almost impossible to separate them. If you think about it, if you're having a big fight with your partner and you're angry and you're upset, sex isn't going to go very well, right? Same thing in reverse. If you're having physical issues, it's going to affect you psychologically. You get frustrated, depressed, anxious. So the two really go hand in hand and play off of each other and frequently spiral. So be aware that you need to seek a mind-body approach that looks at both your physiological health and your psychological health to have a happy and fulfilling sex life.
How do you know it's time to see a therapist?
When you start having problems. If you're noticing you're having difficulty, if we're talking about sex therapy, not just relationship therapy in general, when you start having arousal difficulty, having trouble with erections, having lack of orgasms, decrease in desire, when you start having problems, then it's time to get some help, because there's so many treatments available and we can fix it.
All right, Dr. Palace, you got me blushing. Thank you so very much for
this quiz
I failed. We appreciate your time.
Thank you very much.
Sure.